What health and social care do you want? That's the question we at Llais have been asking the people of Wales. As the independent body that reflects the voices and represents the interests of people in Wales, we want to know what works, what doesn't, and what needs to change so that we can help create fairer and more balanced health and social care services for everyone. I'm Alison Thomas, Chief Executive of Llais, and today we're talking about our project, the Health and Social Care We Want, with Jenny Mushiringani Monjero and Rebecca Lithgoe from Llais. Hello, we're here today with Jenny Mushiringani Monjero and Rebecca Lithgoe from Llais. Welcome both.
Thanks, Alison.
Would you like to tell us a little bit about what you do in Llais?
Yeah, so I'm the Public Participation and Involvement Lead at Llais and coordinate a lot of our All Wales projects, kind of bringing the voice of people across Wales together from all parts of our organisation so that we can hold those national conversations.
Thank you.
Yeah, and I'm the Head of Insights and Engagement, and what that means is supporting all of our teams to go out and talk with lots of people across Wales. And just engage with us in as many different ways as possible, really listening to what people have to say about health and social care in Wales, and also then looking at what is it they've said, how do we get those insights out, what is that data telling us, and using that to go back and influence change.
Great, thanks. I want to spend a bit of time today talking about our Health and Social Care We Want project and why it's important to Llais. So a little bit of background, I think, is when we were hearing from people across Wales in our first few years of existence, we heard a lot from people how they weren't really clear about the rights that they had in health and social care. Yeah. We were also seeing quite a bit of indication that what they expected from their health and social care services had changed through COVID. People are very well aware of the pressures that are facing health and social care services, and that affected what they thought they could reasonably expect from those services. And of course, if you're having a conversation about rights, then the natural other side of that is responsibilities. And we hear from an awful lot of people that they value their health and social care services. They want to make the best use of those health and social care services, but actually it isn't always easy to know how best to do that. So having the right advice and support from services is really important. So we needed to do a little bit more digging to get under the skin of that a bit more. And I think that's where the Health and Social Care We Want project was born. So with that in mind, would you like to tell us a little bit more about the project and why it is so important to us at Llais?
Yeah, I think one of the first things that for me sets the health and social care we want a bit differently to some of the other work that we've done at Llais is because we really wanted that project to have that national conversation feel and to make sure that all people in Wales had an opportunity to, tell us their experiences and share some ideas around these themes of rights, expectations and responsibilities. But we wanted the project to go a bit further than that. And we want to give it this real futures focused. So really giving people the opportunity to think about, okay, this is what I've experienced. This is what health and social care means to me right now. But what do I want? What do I want it to be for the future? What could it look like? I suppose giving people some permission to think differently about how their care can benefit them in a way that would help them to have independence for as long as possible across their lifespan. So making sure that we were framing the project and the way that we were speaking to people with that kind of futures focused idea, that kind of permission, those open gates for people to think big, to think differently, to almost step outside of their current experiences and to reflect on it in a different way that allowed them to start to come up with potential solutions or things that they would like to see, or even to take hold of things that have been really good and to want to advocate for more of it. So this was a chance for people not just to tell us the day in, the day out of what's going on, but to give them that opportunity to really think differently about what health and social care services could look like, but also how they could engage with those health and social care services a bit differently. And I think that's, like I said, gave this project a bit of a different feel to some of the other work that we've done at Llais over the last few years.
Thanks. So that's quite a big ambition. Tell me a little bit about how we went about it and how you tackled it as a project.
Yeah, so I think whenever we're approaching a national project, we're looking to hear the voices of as many people as possible, then we need to make sure that we have that offer in as many ways as possible, so that people can choose how they take part, when they take part, what that looks like for them and meets their needs. And so we really approached it from that space, thinking about, okay, we can do a survey. It's not for everybody, but surveys work. It's something that you can access in your own time. It's something that you can do in the middle of the day, the middle of the night. So having a survey is one thread in engaging with people. We wanted to make sure that we built on those conversations. In our everyday work, we're always engaging with people. We're in those communities. We're having people come into those spaces with us. So we want to ensure that continued through this project. So that really was about how we work regionally, how we work in our communities to have those opportunities present. It's also how we could support people to take part individually. So one of the things we offered was the opportunity to have a one-to-one conversation, the uptake of which was massive, completely unexpected, a really, really lovely surprise. And so it's all about having that kind of mixture of how we go about it, of how we have that on a national level to go out. And some of it also was really about having a targeted approach. So what are the communities that we don't hear from that really need those voices amplifying? Who are our connections that we've got within communities to do that? And so it was working alongside other organisations and their expertise to think about how do we maybe tailor some information, or how do we speak with groups and individuals to get those ideas forward. It's a really exciting mix of things.
And I think there was a lot then from once we had come from that kind of point of view of thinking about how we wanted to design the engagement. The next part was really then about how we gave the invitation for people to be, to be able to come in and engage with us and share their stories. And so we did a lot of thinking also in terms of some of the communications and the language that we were putting out around the project, how we could get people to want to be involved and to share their experiences with us. And, that was done over a number of different kind of campaigns, whether that was in kind of printed media or social media. We set up a dedicated web page on our website so that we could drive people to a location to get all the information that they might need about the project. But one of the things I think was really key for me was that we set up a inbox, a mailbox that was for the project specific, and that allowed us to have continuous conversations with people. So somebody might have completed the survey, as Becky said, and they might have requested then to have a one-to-one conversation with us. But then after that one-to-one conversation, there was an open gate there then for people to continue. We all know sometimes when we're in these kind of environments, we say what we say, and then we go away and think, oh, I wish I'd mentioned this. I wish I'd mentioned... Having that inbox, something as simple as having a dedicated inbox where people could then send updates or other thoughts, or, they could just tap in and say, oh, actually, I haven't heard for a couple of months what's happening with the project. And we were able to really, I suppose, humanise the project, because it gave people that access to us as an organisation to be able to engage how they choose, when they choose, and to really, allow them to say what they wanted to have their say in the fullest possible way. So, it was really interesting. I think just some of those kind of more nuanced things that often we don't think about. We can think about the design of the engagement, and that absolutely is really critical in the starting point. But then I think the invitation and how we communicate those offers is also equally as important.
Yeah. I think we kind of approached it almost like, how do you host a party?
Yeah.
It's like, and you don't host a party just by everybody just suddenly appearing in a room. It's like there's a whole set of processes that go on before that. You know, that invitation is so important because your guests know what to expect, and we need to approach an engagement in this way for this project in exactly the same way. And if we talk about rights, that feels quite big. It feels quite nebulous. It's kind of like, it's huge, you know, rights in health and social care. What does that mean? And so by really sitting in that space and really thinking about what does it mean to be part of that conversation? How do we want people to feel when they take part? We want them to feel that they're valued, that they're listened to, that something's going to happen with what people tell us. We really have to think about that language and how we design questions around rights. We can't just say, do you know what your rights are? We might well have asked that, but there has to be more to it than that. And so it comes right back. And so, yeah, like that, hosting a party, let's think about what it is. How do we want people to feel? Do we want them to be in that party, you know, and kind of energized and inspired? Do we want them to feel reflective? And all of our work is really about how do we design those hosts?
Yeah.
How did we do that in a way that enables us to stand out? There's an awful lot of discussion day in, day out about health and social care services in Wales, about the pressures that are facing health and social care services and what that means from people. So how did you manage to connect with people so that they were comfortable to share what they thought with us because they thought it might make a difference?
I think there's something Jenny said that's really, really important there about that continuing a relationship. I think what stands out about it is that this hasn't stopped. There is no end. There isn't just, it's a question, thank you for your answer. And that's the end of that relationship. By having that inbox, by having continued conversations, that's what makes it stand out. It's not a finished conversation. We haven't come up with a solution that's going to fix the system, and that's the end of it. And I think that's really, really important, that it's about building that kind of relationship of trust. It's about letting that on go. It's about feeding back as well. And that's not to say that doesn't happen anywhere else, but I think that helps this piece of work really stand out. I think we were also really, really mindful that there is a lot of consultation, a lot of asks going on for people, you know, whether that's about health and social care. And lots of members of the public we spoke to said exactly the same thing, but I've answered these questions. I've had these discussions. Why are you not looking at the information that somebody else has got? So I think it's been really mindful that is going on, and that there's always a balance, that it doesn't have to be a constant questioning and answering relationship. That actually, if somebody tells us they've just done a bunch of questions over there, well, let's go and have a conversation with them, you know, whoever did that piece of engagement work, that consultation, then that voice is in there, and let's not lose it when somebody said it. They might not re-engage. So it's a couple of different things for me that really makes it stand out in that way.
Yeah, and I think one of the tools that we created as part of our engagement offers was this idea of a self-facilitation pack. So I think it was also acknowledging that maybe we are not the right people in this moment in time or in this space to have that conversation. And as Becky said, working with some of our kind of community partners, some of those people we already had trusted relationships with, to be the mouthpiece of Llais almost. So we created a toolkit. Again, it wasn't a recipe or an instruction manual. It was just some guidance, some ideas for people to host those conversations on our behalf. And that could be other community organisations speaking to the people that they currently support. It could be somebody in their community who feel that their street or their neighbours should really be part of this. And it could be somebody as an individual taking hold of that and having those conversations. And again, by being helped to have that inbox and that kind of way of having continuous conversations with people, we were able to support other organisations to deliver that self-facilitation pack. We were able to support people who had maybe a one-to-one conversation with us, who then expressed an interest in getting some of their family members or their neighbours or their community involved to have those conversations on our behalf. Because I think the other thing sometimes, as I said, we are not the best people. We are not best placed for a number of different reasons in that moment in time, maybe because we haven't already got that relationship, or people they don't know who we are, so how can they trust us? It's about finding those levers, those people that they can open the gate, drop the seeds of who we are and the difference that we've made previously or the work that they're aware of, so that we can help build that trusted relationship and that continued conversation moving forward.
You talked earlier about making sure that we gave the opportunity for everyone in Wales to have their say. And that's really important, isn't it, in terms of making sure that we are able to give a voice to those who are underrepresented in relation to their health and social care services. How did you go about identifying the barriers that might be present that might stop them talking to us, and how did we go about addressing some of those?
Yeah, I think we hear a lot at Llais about barriers to taking part, to having conversations. That's part of our day-to-day work when we're engaging with communities, and recognising when we're not engaging with communities as well. So I think as an organisation, that's about how we reflect on our practice, and understand where those gaps are in the work that we do. And so part of it for us is, and by no means have we got it kind of perfect. We haven't spoken to every person in Wales, and there are gaps in the work that we've done. And so part of it is about understanding where those gaps are, looking at what that might have caused that or created that, thinking about where those barriers are, speaking with our teams that are out on the ground day in, day out, and seeing where, what they're experiencing. And those barriers could be lots of things. It could be around the language that we're using. Again, I come back to that thing about the language of rights. It can be very, very hard to access that. So it might be some of that. So we did a lot of work on repositioning questions, having entry points for those questions. We did a lot of work around giving people the time and space as well, particularly in one-to-one conversations, setting them up as this. Usually this takes about 45 minutes, and some of the one-to-one conversations I was involved in took 2 hours. So it's about giving people the time and space that they need to get to what we want to understand. But there's so much richness that goes on even when somebody's not answering a question.
Yeah.
It doesn't have to look like that. Our self-facilitation toolkits were there, thinking about, how can you tailor this? This is just an idea. So that really helped. And then we had some really, really practical things like, having materials translated into other languages. So they were available in English and Cymraeg, other languages as well. We had opportunities to have things put into BSL and Braille. So thinking about what are those accessibility points. And I think importantly for overcoming barriers is really about knowing the communities and think, who are those community connectors? And not just kind of helicoptering in and thinking that we can go in there and do it, because we can't. We've got to be really, really honest about that. Just because we engage with groups every day doesn't mean that we can just put ourselves into a new space and go, yep, we know it. We've got the questions. We've made them nice and simple, and we've got them in lots of languages, and here we go. And it's like, that's not how humans work.
No.
And we have to really think about how do we do this in a human to human way, and not just go in to extract as much information as possible. And then I guess in other ways we try to, be in places where people are, play games, we've got speech bubbles that go out and people can complete them in that way, have activities around it. So it's not always about asking a question. It's just about being present, having some fun sometimes, and seeing what comes as part of that, and just accepting that all of that's okay, and that it's not perfect, and that's okay as well. We want to be there though. Desperately want to be there.
And I think that was part of when we think about the insights and the data we gathered. We've had, Becky and we've had some really interesting conversations with some of our own staff at Llais, as well as some of our partners, about, well, how do you turn the fun stuff, the speech bubbles, the random drawings that, into actual tangible things, and I think, again, that's part of doing really good, meaningful engagement, is not to be afraid of how or what that data looks like coming back in. That's our problem to figure out, and we'll figure that out, but it's about, as we keep saying, giving people space, giving people choice so that they can, choose to join an activity or engage how they want to, but they can also choose how they feed in. And I think that's really important when we do speak to some of those people who, come from underrepresented groups. If we think about people with complex needs, with learning disabilities, with non-typical communication styles, we have to think outside the box. We have to think differently, because their voice matters. It might not look the same as other people's voices, but how they feed in is also really valuable to this national conversation. And so I think part of that was a lot of learning for us, but also empowering some of our teams then to not be afraid of what the data looks like, and to just give it to us in all those kind of raw formats, for us to unpick those insights. And I think that's one of the barriers that we can sometimes get into. And I think especially in public services and health and social care services, we can panic about those kind of things. Oh, this doesn't fit into my system. It doesn't fit into the normal way that I analyze things, so I'm going to avoid it. Whereas actually, these are real great opportunities for that more creative thinking, that, doing things differently, but also building those trusted relationships, because it's about saying, I hear you. However you want to communicate with us, I hear you, we hear you, and that's okay. So I think that was really important as part of this project.
Yeah, and there's something like I started by saying about, we've got a survey. And the survey's really neat. It's dead easy to analyse, isn't it? It's dead easy. Everybody's, it's a lovely spreadsheet that comes out. It's all in nice, neat boxes. And it is really about that permission to do things differently. And we'll manage the stuff that comes in as it comes in. It was a real invitation to people to say, send in photos, whatever it looks like, please just send it in. If you want a survey, that's great. But if it's just photographs of Post-it notes or a picture, a doodle, where we
write us a poem,
anything. It doesn't matter. It's like the Advice Steadford. Yeah, you want to do a doodle? Yeah, of course you want to do a doodle. Yeah, it's absolutely fine for us to have all that in. Sometimes it's about the conversation that takes place around the activity, and sometimes it's about that end product. And but we just welcome all of that, and we would hope that enables other communities and other groups of people who are underrepresented, who feel that they can't access those systems as well, and they can't make change, to actually just start that process of taking part, maybe just seeing us in a a community venue, whatever that is. It's like, we're not gonna fix it in one project. This has, and this is why this national conversation doesn't stop here, why there's so much more of it, is to continue building up that those conversations, really, and whatever they look like. They can continue to be doodles, and they can continue to be, big 2-hour conversations and focus groups and all those traditional methods that we recognise. But everything is kind of part of that mixture, and we really welcome that mixture.
So quite a lot of enthusiasm, quite a lot of thinking and planning in order to give the maximum chances for people to engage with us and share their views and experiences, which are so vital, aren't they, to kind of inform in health and social care services. What did we actually hear then, and who did we actually hear from? Did it work?
Where should we start? So we heard from over 2,500 people, which is fantastic. And I'm looking at Jenny to correct me. I should know the number better. It's 3,000.
More 3,000.
Yeah.
So over 3,000 people.
It's very exciting. So, and that's big in terms of, for a first national project with this range of methods and tools, and what is a relatively small team taking that forward. So that's really, really exciting that number, has crept from 10 minutes ago from 2,500 to 3,000 in that time. And it's brilliant. We're really pleased that we heard from that many people, and that's across Wales, that's across all counties, that's rural, urban communities, that's across age groups, that's across gender and across different circumstances, representing different health conditions. Carers, all sorts of people took part in that. I'm really, really pleased to see that range.
Yeah, so just picking up what Becky was saying, that part of the project, we were really clear, we wanted to make sure that we were hearing from as many people as possible in Wales, and making sure we were hearing from those underrepresented voices. So we did a lot of analysis in real time, so as the project was developing. And initially, we had envisaged the listening phase of the project to end on the 30th of September. And as that date kind of crept nearer and nearer, we realised actually there's quite significant gaps of people that we really wanted to hear from, and we needed to be part of this conversation. And so in a lot of thinking and talking internally as an organisation, we then decided to extend that listening phase to the 1st of November. And that gave us an opportunity to do some more of that targeted work. And that's where, as we've already mentioned, some more, like we extended the survey into a number of other languages, not just English and Cymraeg. And we looked at different places that we could be or spaces we could start to occupy and build, even at a professional level, some of those relationships so that they could host some of those conversations on our behalf with some of those underrepresented groups. And I think that's one of the ways that we had to really think about the project. When we think about all the people in Wales, we do need to think about all the people in Wales, as Becky has said, urban communities, rural communities, different language communities, different population groups, different people with different diagnoses and what, they might want to bring to the conversation. Carers, and we heard actually from quite a significant amount of unpaid carers, which was really good to hear. I think about half of our survey respondents were from unpaid carers, and we held a number of those one-to-one conversations, and it was just really good to get their perspective as well of what not just experiencing health and social care services, but being an advocate for their loved one in that space. And and I think especially for me, some of the one-to-one conversations I had, there are a number of people who actually just wrote off their own medical conditions because it was more important for them to advocate for their spouses or a sibling or a parent. And that's where they got their fire from, their passion to want to be part of the project. And that was a really interesting thing to go through when you're talking to carers, that you actually get two people's kind of input. So you get that, the experience of the carer and what they're going through, but often they are the best placed person to talk about or talk on behalf of or talk with the person they care for. And so, again, the richness of data that you get from that, and that, became one of our kind of levers, I suppose, to accessing some of those underrepresented voices, especially of people with complex needs or non-typical communication methods who maybe couldn't, feed into us directly, but accessing some of their loved ones and their, those unpaid carers who could help bring that perspective into the play as well. So, it was really diverse in terms of, when we think about all the people in Wales is massive, but actually, who do we need to hear from? How can we do that? And, as we've said, this is really the first of those kind of all Wales projects, and that we're hoping to continue and do more of. I think there was also that, that appreciation that this was new and this was okay not to get it all right, and that we could learn through the process. And one of the key things I think that we built in to kind of the design of the overall project was having a lessons log that allowed us to think about, okay, what issues have risen up that we need to consider for next time, but also what successes, those kind of, just happen to happen kind of successes that we can try and harness more of going forward. And I think especially in that space of looking at underrepresented voices, making sure that when we talk about having a national conversation with the people of Wales and being as representative of the people of Wales as possible, there was a lot of those just happen to happen things that happened that we could put into the lessons log, and that we'll really try and harness for next time and build on moving forward.
That's really helpful, thank you. So lots of different ways of going about it.
Yeah.
Plenty of time to get people to know about what we were doing and join us in their own way, in a way that meets their own needs. What did that tell us? What did we hear? What did we hear from people?
We heard
across Wales?
so much. We heard lots of individual experiences, which are, super important, and we'll be doing things with those as well. But more broadly, we heard things from people about how important it is to be listened to within services, how important it is to be valued. These kind of big themes really coming through there. We heard about, the importance of having things joined up as well. So many of the stories that I sat through in one-to-one conversations that we see coming through more broadly is about gaps in services. I've moved from this one to this one and it doesn't connect, it doesn't join up. Something's been lost along the way. I think we heard things around clarity of communication, and what it means to get communicated with in a way that you can understand and access. That always comes through really, really loud and strong. And I can think of several one-to-one conversations I had with people where it just, they'd said several times they needed a letter in a particular format and it was system says, no, I can't help you with that. Which is really shocking and surprising, but at the same time not as well, because I think Llais, these are things that we hear a lot of, unfortunately. So those were the kind of some of the broad themes. We also heard some really great examples of good practice, and things that had really worked well for people. And that would be individual staff that they'd come into contact with. It might be, a particular GP or a nurse at an appointment, and or a particular care worker, or or a third sector organisation that had really stepped into a gap for a family. So we heard lots of stories of great people in the system, and the amazing things that they're doing to support people. And quite often those little small touch points are really, really important for people. There's little interaction. So some really, really good examples of what can be done. But fundamentally it was about, I want to be treated like a human. I wanted to be treated with dignity and respect. I want to feel like people have got time for me as well, that I'm not just a number. I'm not just an appointment. I'm not just, a visit that somebody's got to complete as part of their job, that I'm actually valued in that process.
How are we going to go about at Llais using those very individualised perspectives of what health and social care means for people to talk to big system? We're talking about an NHS service that's very large, is quite complex, similar for social care services. How are we using what we've heard to drive change and improvement for people? Because let's face it, people share their experiences, don't they?
Yeah.
Because they want something to happen as a result. So tell me a bit more about that.
Yeah, I think the health and social care we want really opens some of those further conversations. It's not saying that lots of what we heard isn't new, but we're framing it in a different way. And I think that's really, really important, and something that we're doing differently with it. We're not going, here it is, here's what we've heard, off you go and fix the system. We want to work with different services to look at how can we embed some of that good practice that we've heard, and how can we challenge some of the practice that we don't want to continue, and some of those other barriers that people are coming up against. And so part of it is really about sharing what we've heard loud and clearly, and not being apologetic for it, and not going, oh, look, we're still hearing this. Actually, it's like, we are still hearing this, and it's really presenting it in that way. It's really presenting that to back to the people that we've heard from who have taken part in that engagement, sense checking some of it. Is this right? Are we reflecting what we've heard? Is it, it's because it's gone through our filters. So we want to make sure that's okay. We want to get that out to as many policymakers and decision makers as possible as well, and reflect that back to them. And I think really importantly, one of the things that we're looking to do is actually, how can we pilot, co-design, co-create some of these solutions, some of these changes? Who is it that we need to work with in order to do that? Or who can we connect up? It's not necessarily that Llais is the organisation to be in there doing that, but actually we know that somebody in Gwent told us about something that's really, really exciting, and how can we fix them up with somebody in North Wales who's got a similar problem but hasn't heard of this solution? So how can we maybe connect up parties as well, and share what we're hearing about other ways of working, in that kind of mishmash of data and stuff that's going on in this really complex system. I think Llais is really, really well positioned to go, we heard this over there, we've seen this. Let's take it to the gap over there that we've heard about, that we're in a really, really unique position as an organisation to be able to join up some of those dots where they're really busy delivering, and we're not busy delivering in the same way.
And I think, building on that essence of it is there's not just one thing that we're going to do with all of this information. We're going to be continuing that conversation, as Becky said, and absolutely, we don't want to just deliver health boards with a list of wonderful principles and say, here we go and do this. We want to give them those kind of practical ideas for change that they can look to embed or to pilot themselves. But we also want to be part of that piloting to see if we can get it right. I think there's a part for us to play as an organisation about internalising some of those things and being a role model in that space. And how do we do that? But there's also then looking at the other elements of what we do as an organisation. We can make representations, and absolutely, based on some of those conversations we've had, some of the things that we've heard, we will be making representations, whether at a local level, so to an individual health board or a local authority, or at a national level. If we need to make a representation to all the health boards in Wales, then I think, we need to take some of this information and we need to go ahead and do some of that, because that's who we are. That is what Llais does, and I think it's not forgetting those other elements of us as an organisation and just thinking, this is what we're going to do because this is the project. But it's about how do we, use the project to drive some of our other work as well. So I think it's going to be really interesting to see where these findings take us, and as I said, how we internalise some of that as an organisation and be prepared to be a bit of a role model or a critical friend maybe in some of those spaces to really use the voices of people in Wales to drive some of that change that's really necessary across our services.
How do we go about that in a way that keeps things simple to the kind of the fundamental principles in what is a very complex, fast-paced, changeable environment? The changes that are taking place in Wales in relation to both NHS and social care services are moving fast.
Yeah.
How do we keep that focus on the things that really matter to people, on the fundamental principles that affect how they look for their health and social care services?
I think part of that is in terms of the thematic grouping, in terms of what we've heard. I think it's having that understanding and acknowledgement that we can't fix everything. So it is about looking at where do we start and where will have the most impact. And as Becky said, some of those things that people have told us are fundamental, foundational things that cut across all parts of services. And, communication is a big one. And so looking at, where are the opportunities within that communication landscape that we could maybe try and have some change. And I think part of that will be those co-designing those ideas for the future, so that by the time we're delivering it to the health board, it's not just an idea, but we've got some real practical steps that can make it as simple as possible for them to implement. Yes, there will be that contextualization of that. So, we will give them that kind of guidance of how you might be able to implement this, and they'll have to look at, how does that fit within their localized systems and what, some thinking around it, but trying to make it as simple as possible rather than just throwing out these big complex ideas and saying, right, you need to now make sure that everybody is communicated with in a way that suits them. Great, but what does that mean in practice? And I think that's where phase 2 of the project is going to hold some space in terms of looking and trying to answer the exact question that you've asked us. How do we make this as simple as possible for implementation? And having those conversations, those continued conversations, bringing a range of different people together into spaces to challenge some of the findings that we've heard, some of the things that we've heard, and to try and inspire some of those, I suppose, real out of the box thinking, those big things, and then narrowing them down into what is practical to be delivered in reality. And I think that's now we're entering quite an exciting part of the project, because this is all about that idea of co-creating, doing something differently, as well as looking at about what else is going on in Wales and how we can make sure we're not duplicating and we're linking up with partners in the best way possible.
So I think we can think of the principles that we're hearing from people as a bit like a kind of a coat hanger, best analogy I can come up with in the moment of how we take this work forward. So whenever we're having a conversation, whether that's with a health board, a policymaker, whatever that looks like, with communities, we can think about how is the work that we're doing hang from those principles? How does it, fall beyond that? So we've got a coat hanger. We want to design a service. Well, how do we make it look like a shirt on that coat hanger? How do we make that service really hang from those principles? And I think that's one way of how we can embed it going forwards. How we ensure that, that those themes that we're hearing from people are always in the conversations that we're having, are always part of that process. Coat hangers.
Okay, coat hangers. Okay, so you both talked about the importance of bringing people together, and kind of working together to solve some of the difficult challenges that are facing and have faced health and social care services for some time. Why should Llais be the body that's able to bring people together to work around solutions?
So Llais is really well positioned in that we're an independent body. We're not wedded to any particular part of that system. And so, that independence is absolutely key. We are there to do what is best for what people are telling us. We are that citizen voice body, and we want to ensure that citizen voices is absolutely core. And this is what we're hearing through the We Want principles. This is what, it's coming through loud and clear. We've also got that advantage that we sit across all of the system. So we're independent, and yet we're in all different parts of it, but solely there for the best interests of people in it. And that's really unusual. It's really advantageous. And it gives us that advantage of being able to see a whole, and when you're looking at a complex system, so often when you're in it, you can only see the part that you're in. You've got that really, you might have, what you think is a wide view and a wide perception, but actually it's completely contained by your experience in it. And because there's so many parts to Llais, we've got different teams in different parts with different expertise. We can see all those parts when we come together as an organisation. When we hear all those things that people are telling us, we're able to connect it up. We're able to see where that is and leverage that independence and that kind of inroad that we've got to decision makers and policy makers. So it's a really exciting position to be in as an organisation.
So both of you have spent an awful lot of time asking others the health and social care they want. I'm going to turn the tables on you two and ask you to tell me what, if you were describing the health and social care you want, what does it look like?
I'll go first, shall I? Okay. I suppose the health and social care I want is one that celebrates diversity and difference, so that we can truly be person-centred. I think at the essence of what we've heard, but also what I've experienced myself, is that I want to be treated as an individual, as a human. And I think services that look past a diagnosis into the context of who I am and why I might be experiencing things the way that I experience them is really important. So for me, it's that those services that really celebrate difference and diversity, so that we can be holistic in that kind of person-centred approach to health and social care is what I would like to see.
It's a big question, isn't it? And it's like, I know
Which you've been asking
everybody.
else.
I know. I'm just thinking, oh my goodness, I've asked this question to so many people, and I heard so many answers. The health and social care I want is one where I'm treated as a human being, not a human doing. So it's that same thing about being person-centred and not just a number. And I think for me personally, importantly to that is to know when something is or isn't going to happen. And so that if I'm waiting for treatment for something, or if I'm waiting for an appointment, I want to know when that isn't going to happen as much as is going to happen. So again, it's clear, open, honest communication, because I've got all that time where I am just being, you know, and day-to-day life happens and continues. And so I need to, I want to be a human being at the centre of it and just have some real honesty as part of that relationship.
Okay, so we've talked a little bit about what we've heard and how we're going to use that to help influence health and social care services to respond to what we've heard and to work with people to drive change. How are we going to use what we've heard to look at how we carry out our own activities and how we behave as an organisation?
Do you want to start?
No, you can.
Okay. So I think Jenny alluded to it in that piece about, you know, giving people permission to try out how to do things differently, thinking about the lessons that we've learned and really embedding through this project some reflective practice. We've, you know, come together as a project team regularly to look at what's going on, where are those gaps. And that's been something that in all kind of national projects going forward, whatever that looks like, that's a really useful way of working. We've brought in, you know, different team members from different parts of the organisation as well. So we've gathered different perspectives as doing that. And I think we can continue to do that as approach and really, you know, learn from that way. And then this idea about, you know, different ways of engaging, that it's okay to do it differently. And it's also okay if it doesn't go quite right or quite well the first time. Just means on that day it was an off day or it just didn't happen. The other things got in the way. And, you know, that could be the weather, it could be transport, whatever that looks like. There are lots of reasons why people don't take part in that moment. And we don't always know what those are. So I think it's not just going back to business as usual because you've had one not great experience. So the default isn't nobody showed up, so I'm just gonna do my survey, I'm just gonna do my emails out as normal. So it's about having that multi kind of pronged approach all the time. It's about being able to really take time to sit back and reflect and understand what is going well as what isn't going as well. How do we readjust and reposition? And just make that space as an organisation. I think it's really, really important for us all as teams to be able to not just be on that treadmill of delivery all the time. It's like, yeah, you know, we're so keen to make these changes for people. We so want to see the health and social care in Wales to have those improvements for people to get the care that they need when they need it, that we can be really busy doing. But we can't always deliver on that if we're not sitting back and understanding how we're having those conversations with people and what we're doing with what we hear so that it has real impact. We can gather it all up. We can sit it away on a spreadsheet somewhere. Actually, how do we make it impactful? And so we have to pause in order to be able to do that really, really well. So I think that's one of the big learnings going forward is it's not rushing. It's like, it's just, we can do this gently and we can be kind to ourselves as an organisation as we do it.
And I think it's about embracing that flexibility. So as I said earlier, you know, the listening phase of this project was due to end on the 30th of September. And I think it's about, you know, creating an organisational culture and environment where we can say, hang on, you know, yeah, we could have finished on the 30th of September and we would have had XYZ data and, you know, that would have been perfect because it fitted into the original timeline. But if we want to do things that are high quality and that have real meaning and purpose, that we can be flexible as an organisation and not being afraid to say, you know, hang on a minute, you know, like, actually, is there any chance? Can we have a conversation about what it would look like to extend this part of the project? Or is this an absolute deadline? And if it is, the justification why it has to be an absolute deadline, or is there flexibility around it? So I think that flexibility as an organisation is really key. And part of that comes, as Becky said, from that permissioning and how we permission from kind of the top down, but also how we create, you know, space for that information to come back up. And I think one of the other things that was really key for me in this project is that we tried really hard to keep as many people in the organisation as possible up to date with what was going on in the project. So we had our weekly project meeting with the small project team. We then had wider meetings on a fortnightly basis with comms and engagement staff across the organisation. And then we also came and hijacked some of our all staff meetings, our fortnightly meetings, and just to tell people what we were hearing, where we were at a project within the project, so that other people in their areas could recognise either how they could feed in, or, you know, it might spark something, a gap or an idea for, you know, how we can operate differently in other parts of the organisation. So for me, when I talk about us kind of internalising some of those principles that we've heard through We Want, it is really about how we can be that open, flexible organisation where, you know, the staff at every level feel empowered to be able to have those conversations, to throw out new ideas, as Becky said, to try things, even if they don't work. It's not failing, it's learning. It's about learning, okay, this doesn't work in this context, or actually this didn't work right now, but with a tweak, or can we, you know, and not being afraid to speak to other people about that learning as well, so that we can, you know, together collectively move forward to try and embed new ways of working, create best practices, good practices that work for us as an organisation. And then, as I said earlier, that's when we can then start to become that role model or that critical friend to some of the health and social care services across Wales, because we've lived and we've breathed it, and we understand the icky bits, the hard bits. We also understand where there are those gaps for opportunity to move forward, and that's how we can start to change, I think, some of the narrative around systems, complex systems, processes, what engagement can look like, and how it, invested into well, can actually be a really good tool for saving people time in the future, creating things that actually work, and or even as an evaluation method for people to do that kind of self-reflection, that sense check of, we think our services are working okay right now. Well, let's just invite some people in to make sure that is the case. Or, how can we now build on this and take it to a new space, a new place, and to continue that cycle of improvement. So, yeah.
Yeah, and for me, there's something as well about when we're thinking about engagement, and I'm thinking about one of the principles around, joined up services. Well, how do we do that as an organisation? And engagement isn't just the responsibility of people who have engagement in their job title in the organisation. It's the responsibility of all of us as an organisation. We all play a part in our supporting of those roles. It's not just if I'm the person who's going out having a conversation, maybe holding those one-to-ones online, that's not just me doing that. There's a whole organisation that supported that. There's a whole set of systems that are behind that. So how do we ensure that we're joined up as an organisation? Yeah. How do we ensure that all of our staff and volunteers are also empowered to take part in engagement events and engagement activities? So our survey, we want to make sure that, we're, as individuals in an organisation, we're also service users. We've all got those experiences. So how do we empower people to take part and to feel really proud of an organisation that they can go and share these things to their local communities as well, and to the networks that they're engaged with, because ultimately, we've all got those connections out. So I think there's a principle there in joined up thinking and in joined up services that's really, really core to how we work as an organisation.
Thank you both very much indeed. Thanks so much for watching and listening to episode 2 of the Health and Social Care We Want. Llais is always looking to hear your views and experiences of using health and social care services across Wales. And you can find out more about how you can join the conversation by visiting our website at www.llaiswales.org or following us on social media.